From Terry G, they call him Brigadier. Still on the way back on this day. Flow 94.9 FM. Umwa here, the flow of gas since that on top of this makes sense afternoon. And yes, 26 minutes don't work. I come up for 3 o'clock. I salute you to this afternoon. So yes, we can let you know, say, I get some special visitors, August visitors inside this month of December. They don't enter for inside studio. This makes sense afternoon. And yes, I let you know, say, I deal with senior men them. This one for inside the Abia World's 8th day Abia State response. And I'll talk the matter they talk about HIV for inside the general population and PMTCT. Yes, I let you know, say, I get Dr. Onyedikachuku Ejim. I greet you this afternoon. Now with the team lead Global Fund PMTCT HTS Project Abia State. I greet you this afternoon.
Good afternoon, listeners. You're all welcome.
Okay, and I did with Undubisi Kanu, Abia State Agency for Control of HIV/AIDS, ABSACA. I greet you this afternoon.
Thank you very much, and good afternoon, the Abia.
Okay, so first, we could talk about World AIDS Day. Just a few days ago, we've been celebrate World AIDS Day. I think on the 1st December. So yes, under the theme overcoming disruption, transforming the AIDS response. This one, as it be say, now the matter now they look so. So what you got to talk about?
Okay, thank you very much, and good afternoon again, Ndiabia. So for the theme overcoming disruption, this actually means directly confronting two major shocks that has been an impediment to the response of the HIV/AIDS. Mm-hmm. Then the first being the severe service disruption caused by the, of course, we all know the COVID-19 pandemic, and also which fractured our testing and treatment networks. And of course, the second one, which is the profound funding disruption from the international partners. We all know that most of the international partners are now no longer coming forth with their sponsorship, and all these things threatens the sustainability of our gain, the gain that we have been able to achieve all these years. So transforming the response, it's our necessary evolution. Why is it so? It's so because it means we are now moving from a donor dependent model to a Nigerian owned, not only Nigerian owned, also the public sector funded system that is integrated into primary healthcare. Then practically, it means that we are building local capacity, so that we can leverage on our local technology and also advocate fiercely for our government to fully fund and lead this fight, and as well as ensuring that no mother, no child or person living with HIV is left behind because of uncertain foreign aid.
Okay, so this will not take you to the next question. So, what will be the current HIV prevalence in Abia State compared to waiting there at the national level? Which people they affected past? And meanwhile, maybe if you give our listeners a background on what will be HIV.
Okay, HIV is a human immunodeficiency virus.
Okay, and
it's a virus that once introduced into the body system, it affects the immune system that will now make the person vulnerable, to be infected with other what we call opportunistic infections. That if the person is not actually detected on time, enroll into treatment, the person might fall to AIDS, which might lead to death. So back to the question that you've just asked. So based on the latest epidemiological data that we have, so Abia State presently has an HIV prevalence of approximately 2.4, and this is among adults between the ages of 15 to 64.
15?
Yes. So, and this
person
is
with the 15 they carry HIV.
Yes, in the course of the interview, there are other responses that will bring so that people will now understand why it's between this age bracket. So okay. This is significantly higher, more than the national average, because the national has an average of 1.3%. So then classifying us as a high burden state. Remember that when we say high burden state, doesn't mean that the burden is so much on us. We have other states that is bordering Abia that has higher prevalence rate more than Abia. States like the Cross River, you know, the Akwa Ibom, the Imo, you know, and all these persons come to transact business in Abia. And most of the times, because of stigmatization issue, most of these persons that are infected with the virus don't access treatment in their respective states. So they just come to Abia, you know,
treatment
to now. So and once they're enrolled in Abia, so it's not counting as one of our body. It does not mean that Abia is the but based on the statistics that we have so far, so the epidemic is not only uniform, it's disproportionately affect adolescent girls and young women. And for us in the for us in the program, is that the AGYW, and this AGYW is for adolescent and young girls between the ages of 15 to 24. So with the prevalence in this group being severe times higher than in their male peers, for example, it's higher than most of the male, you know, of course, within the same age bracket, the 15 to 24. So, and of course, we know that it's because of certain key drivers. So, and the key drivers are gender-based violence. We have rape cases, and you know, this within girls and young ladies among this age bracket are sexually active. So, we have the gender-based violence. We also have the economic dependence, of course, or we can't emphasize what the economic situation in the country. Then, of course, then the intergenerational relationship, the sugar daddy issues, you know, taking advantage of the vulnerable girls and the young ladies. So, and we also see higher concentrations among also key populations. There are certain persons that we call key populations, which also help drive the prevalence rate. Then including we have the female sex workers and their partners too. So, and their clients, so to say. And also it's in urban and pre-urban clusters. So this data is not just a statistic, it's a map that guides our targeted intervention for the general population, also in our intensified focus on PMTCT to protect the next generation. Because all this, for example, for the young girls between this age bracket might be exposed maybe through rape, and in such circumstances the person might get pregnant, and if such person, you know, does not know the HIV status, might bring into this world a child, an innocent child with HIV, and that's what we have targeted, and that's where our area of concern for intervention, to ensure that no innocent child is brought into this world with HIV.
Okay, so make we just quickly look up, make we just look eye for the impact of disruption. The team, they speak of overcoming disruption, critical disruption like this. People don't talk and well. You understand? And based on this matter, we be say they can with major foreign agencies. So sometimes they check back, they do one or two things, they change priorities, and how this particular uncertainty don't impact HIV response inside Abia State. And what will be the urgent case for federal government of Nigeria to take full ownership and leadership of this particular funding? So,
all right, thank you very much. So for the scaling back of funding for these projects, it is very predictable what can happen. When you have a steady supply of funds, it's easy to plan long term. But when the funds are now withering away, it is difficult. For instance, now, if the United States government decides that we're not going to fund this project anymore, do we have drugs for the next 18 months to sustain people who are already on treatment? And you see, that leads to the next challenge. The next challenge being that we have already enrolled people into treatment in Abia State. Many of them have attained viral control. That means the quantity of virus that one is carrying in the body is so low that they may not be able to transmit. Now, if these fundings are pulled back, what happens is the drug availability is reduced, and this now leads to those viral loads coming up again. Thereby, all the gains that have been gained so far will be eroded. And another challenge we also have is that remember that when the other governments fund projects in our country, what they do is that they select particular diseases. So if they are funding HIV, they may not fund malaria. And so you can imagine HIV is getting all the attention, but malaria is falling behind. And so all these challenges coming from depending on foreign intervention is creating a lot of issues for us. Sustainability becomes an issue. It's hard to sustain gains that were made. And so the call for our federal government to take over funding is very, very clear. Now, if our government eventually take over funding of our healthcare system in total, a lot of things will be very achievable. One, predictability. That means if the federal government commits to giving 25% of the annual budget to the health care system, then the healthcare system can plan across. It will no longer be only HIV. They can plan for malaria, they can plan for diarrhea. They can now do a cross-sectional planning across all the disease entities so that everyone receives appropriate attention as it is deserving. And also, I believe that if they come in, it becomes easier to be prudent with funding. I can tell you that a lot of times when foreign agencies bring in grants, it is easy to become wasteful in a lot of things. Sometimes the funds are not necessarily going to solve the problems, that they were meant for. Sometimes they go into other things that may not be necessary. So, but when a government is funding a project, they demand accountability on a different level. They put in systems that make sure that there is no wastage along the line. And so, but we're not asking that the federal government should take over the funding in a sweep or one night. We're only asking that discussion, that intervention should begin to come into phase. I mean, they should begin to say, okay, in the next 2 years, we're going to take over 20%. In the following 5 years, we're going to take over 50%. So that we do not wait until the foreign funding goes away and they will now come with their own funding.
Okay, so we could just quickly talk about waiting the government of Abia State they do currently now to tackle this HIV for general public. Like what una do so far? Which recent policy or campaign we be say una don't do so far? We be say don't show results.
Okay, so for Abia, I sincerely want to use this opportunity to appreciate the health-friendly governor of Abia State, Dr. Alex Chioma, OTOFR, who has graciously approved for the first time 15% of the annual budget of the state into HIV health-related activities in the state. So, and this is a policy that has come to help push the frontiers of interventions and programs for not only for HIV but all the health relative activities. So, and that's one of the key policies that have eluded Abia in the past, but with the coming of His Excellency and the new DG we have also in Abia, Dr. Oluako Emma Ukebu, and who's our Director General. So she has come with a lot of innovatives and ideas to turn the tide around, so that despite the challenges that we are facing both in the funding, that we'll be able to ensure that Abia is on the right track. For example, for the first time in the history of the Abia State Agency for the Control of HIV/AIDS, we've been able to assess our budget, all our budget implementations. I can tell you it's on the track.
But not the same since?
No, in the issue of the
Why?
I've been in the agency for over 12 years, and believe you me, this is the first time that Abia State Agency for the Control of HIV/AIDS can beat their chest and say all our budget, 50%, over 50% of our budget are being implemented. And when I say implemented, is that not only approved, it's also funds are released for in the implementation. And that's why in Abia today, you can agree with me that everybody in Abia State is now becoming aware that there is an agency called SACA, saddled with the responsibility of ensuring that every Abia knows their HIV status, that every Abia knows that there is the drugs, irrespective of the Trump pause, the drugs are still available. And also we inform them, in fact, there is a campaign, there's media campaign ongoing virtually in all the media houses in the state. And this is as a result of the new innovation brought by the DG, Dr. Eluako Imaukebu, to inform every Abia. In fact, this media campaign is not only in Pidgin or English, it's also in our local dialect. In fact, if you come to our office at our office at Amachara Specialist Hospital, we have in every day, we have records of persons who have relapsed from their treatment because of stigma or wrong information they've got. So, and they keep coming, and this is as a result of the intensified campaign, and we keep enrolling them and ensuring that no Abia will be left out. And of course, our PMTCT activities too, with the renovations of the primary health centers in Abia, has also boosted our efforts that now people from the rural areas can actually walk into our PSCs. Pregnant women can walk into our PSCs, get tested, free, access our antenatal care services free of charge. And
that's for the women. The women they will say get belly.
That's true. And have access to. Then for the programs, our programs we've got across all stratas of the society. In fact, there is an ongoing program in the state for persons with special disability. We've had programs with faith-based organization. We have had programs with World Development, the WDCs. So, and all these programs are targeted to ensure that no Abia is left behind. So, more programs, like I tell you, will be implemented because we have a health-friendly governor who has ensured that every Abia must know their HIV status, and all positive Abians must be enrolled on ART care. And every person that in Abia that is enrolled on ART care must achieve ART suppression, which means what we call every Abia, once we achieve viral load suppression, the transmitting level will be very, very minimal, that to a level that we will be able to curtail new infections in the state.
Now, what do you mean by the transmission this single low? What do you mean by that one?
What I mean is say, once you know your HIV status, we enroll you immediately on treatment. Once we confirm that the person is actually positive, we enroll the person immediately into treatment, and all these services are free. And once we enroll you, I bet you that the drugs are there. All you need to do, just adhere, take your drugs religiously. When I mean religiously, is that ensure that you take your drugs as being directed by the physician. And once you do that, bet you that once you go back after 6 months to get tested, you find out that probably we might not be saying it in that using our RUTK, it might be showing that you are HIV negative. Does not mean that the virus is no longer there. But what it means is that at that point, the transmission level is very, very low. And that's what we're looking at. We're looking at zero new infection. We don't want to get new infections of HIV in the state.
What I want to understand, I know some people go wonder. So if they take their drugs religious, like as you talk, it could be hard for them to give unto another person. Now, what do you mean?
Yes, very, very impossible.
Okay. So now we could talk the aspect of this HIV service now. The people say for rural areas and how far they get all these things we say government do?
Yes. For example, in all our secondary health facilities in the state, like I said, I still give kudos to His Excellency, because what he's actually doing in the health sector is very, very innovative, and it's on this bedrock that will drive the process. Like virtually, persons that move from most of the rural areas to the urban area to access treatment, sometimes it's not because of stigma. Sometimes it's not because of stigma, but because of the services are no longer available at the hospitals within their locality. But in Abia today, with what the governor has brought to the state, doctors are now in our various primary health sectors in the state. Even our cottage hospitals, you go there, people are there. Once you go there, walking at any time, somebody is there. So once you go to our hospitals, government-owned hospitals in Abia, there is always somebody that will give you attention, that will give you all the necessary services that is required. And all these services are free of charge.
Okay. Both the drugs as well?
The drugs is free. Nobody's collecting 1 naira. The government is ensuring that all the necessary contributions that should be made to ensure that every Abia has access to these drugs. They've done their part. And so it's not late for the Abia to reciprocate by ensuring that they access all these services that the government has provided for them.
It's okay. So we could just talk about this matter say concern the HIV response. It depend on partnership. People got to come together to work. So how government, Global Fund Project and NGOs they work together for Abia? Like within the energy they like
Okay.
the collaboration, the partnership level.
Okay, for Abia, for after the end of the World Bank project, we have other funders like we had the Catholic Caritas Foundation of Nigeria that also came to support us. But this Trump pause, actually affected not only Nigeria. But the good thing is that for us, we're looking at sustainability. We're looking inwards to ensure that this is our thing. That government should take ownership, and it is this ownership that is driving this process in the state, with emphasis on Abia. So, and I know even in the national, His Excellency, the President of the country, His Excellency Tinubu, has also approved certain funds to ensure that we now produce ART locally in Nigeria. So that with this way we can cushion the fate of donor dependence. So for us also in Abia, we have the instrument and mechanism on ground to ensure that the sustainability response is sustained, and all these are kudos to His Excellency, who has graciously approved even our 2026 budget that Abia should own the HIV response in the state.
Okay, make we quickly talk about PMTCT. Like what it mean? Because I don't be mentioned them before when we start the interview. So what it mean and why they important to HIV response?
All right, so PMTCT is very, very important. PMTCT simply means prevention of mother to child transmission of HIV. That means what you're trying to do is to ensure that the baby is not infected, even though the mother is infected.
Is it possible?
Yes, very possible. And that is why we want every woman who is pregnant or intending to be pregnant to go for HIV testing. Because as soon as she's tested and she's aware of her status, if she's positive and she's placed on appropriate treatment, the viral load can be reduced to such a level that the baby will not be infected. Now, bearing in mind there are 3 stages or 3 phases where babies are infected. 1 is in the womb. Secondly is during delivery. Thirdly is during breastfeeding. So if we're able to get this woman tested during pregnancy and we begin to treat her and begin to reduce her viral load, it spares this child of any infection. And so this PMTCT model is very important because it helps for proper intervention. That means it helps to prevent transmission from mother to child. And from the statistics done, it has dropped from as high as 45% to 1%. That means for every woman, every child who is exposed, and when we say exposed children, we mean children born to infected mothers. Because the mother went for testing and her viral status was known and she was placed on treatment, it reduced the baby's infection by more than 45%. And that is a good achievement. And so PMTCT is a great model for ensuring that babies are saved or are prevented from contracting HIV.
It's okay. Let's make we really just talk about the mothers them, like what be their response, how you feel convince them say this particular thing is possible, because a lot of them feel the skeptical say this thing if you be say no this kind of fear now.
Also for mothers that are tested, if a mother is tested and if a mother is found positive, it is easier for someone who has gone through what you have been through to be able to talk with you and assure you that there is no problem. So in our program we have people who we call mentor mothers. Who are mentor mothers? Mentor mothers are people who are themselves infected but have successfully given birth to children who are negative. That means they were enrolled early, they were placed on treatment, and when that child came out, that child was not infected. So
Now, when you talk about early, how early?
As-
Like, so you get some women where they discover their belly in weeks. Some they discover and maybe after 2 months. So at what point, mama will be say get HIV now? Go fit do the matter to know when be the best time.
the best time is as early as possible. Like I said, even intending mothers, those that want to be pregnant, it is important that they go for testing. However, if we miss them at the intending phase, whenever a woman decides to go for the testing, it's appropriate. What we want to prevent is to have women coming at the point of delivery, and that is when we are finding out that the baby. It doesn't mean that there's no intervention at that level, but it's just better that if the treatment is commenced for the mother early, then it gives the baby a chance of coming out negative.
Okay, so make we quickly talk about stigma. People will be get HIV, the stigma, how it they affect both the general population and of course pregnant women. Like how they tackle them, and which particular stigma now was pass. The one will be say community they give self stigma or stigma from the health workers. Then will be say that attend to them.
So
Because say some kind of some of these health workers, they're not really the intelligent. So this is now one of the things.
All right, so stigma comes in all forms. It comes from family, it comes from friends. I've had encounters, in the days I was in clinical practice. I remember a woman that I once treated, and she moved all her anti-HIV drugs into a multivitamin bottle, and she was taking it at home. And I asked her one day, and she told me that all her children, she has heard them discuss about all their family members who were positive and how they castigated them, and she could not stand them, her own children, castigating her. So she hid it all through her life, all through the 10 years that she was positive. None of them found out. So stigma is a major issue for us. So one of the ways we used to tackle stigma is, like I mentioned, is the mentor-mother approach. So for the mother himself, remember that the mother is also scared. Just imagine a pregnant woman struggling with the issues of pregnancy, and just imagine a first timer who is also not understanding what's happening to her body. They now come and add again that, oh, we tested your HIV and we found out that you're HIV positive. So working with mentor mothers in the state and across the local government helps to reduce the fear, the anxiety that's attached to knowing one's status, because you're looking at somebody who is just like you, who is positive but has given birth to a child that's negative. So that reassurance coming from another mentor mother also helps to counter the stigma. Another way is to have a strategic community engagement. So in some places we engage with religious leaders, we engage with traditional leaders and women associations, and we try to create awareness on what HIV/AIDS is. Because the impression about HIV over the years has always been that of a death sentence. So we are making efforts through the media like this, trying to get people to understand that if somebody, like HIV is just like another infection. If it is treated, the person stays alive. It's just like someone that has diabetes. Diabetes is also treated for life. Don't forget that hypertension is treated for life. These are diseases that if you leave them untreated, these people will also die. So just like all these other diseases, if one is left untreated, yes, they will have complications. So HIV is much more, it's like all the other ones. Once one is placed on treatment, then you have a chance to survive.
Okay, so we could just quickly talk about something. So which activities will Abia State do for this particular time? They talk about the World AIDS Day. Which local government will now focus on the most? Any community outreach, especially for women who get belly? Okay. How will take Duam?
Okay.
And just on sharp so that.
Okay, so for us in Abia, we had a grand rally where we sensitize the general public, on the or for them to know that HIV is real, and also for them to get the basic facts and knowledge about HIV. And we also provided testing points in all the 17 local government of the state. We activated our local action committee on AIDS in all the 17 AGLs. So there was a testing point, including all our PHCs. We also activated the PMTCT services on for the World AIDS Day. Then, of course, we are here to amplify the media message for Abians to know that HIV is real, but it's not a death sentence. So it's better you don't live a risky life that can expose you to being infected with HIV. Get tested. And if you are positive, we enroll you on treatment. Then, of course, if you take your drugs, you will achieve viral load suppression. Then, of course, not forgetting Her Excellency Onogun Dabia, the executive wife of the governor of Abia State.
That's the first lady.
The first lady, yes, Priscilla Choma-Oti, who was ably represented by the wife of the deputy governor of Abia State. Her Excellency Mrs. Adeze Chidera Metu, who joined the rally, the sensitization rally in Abia, flagged by the Director General of Abia State Agency for the Control of HIV/AIDS, Dr. Mrs. Emma Oluwakukebu. Then, of course, the admin of the Ministry of Education, Health, Abia State, they all worked from BCA around the urban area to actually amplify our voice that together we can achieve the eradication of HIV in Abia. Thank you very much.
All right, so I appreciate you are sitting with us for Inside the Studio this Make Sense afternoon. What is the Abia State HIV response? Thank you very much, Dr. Onyedikachuku Ejim. Thank you. Now be the team lead Global Fund PMTCT/HTS Project Abia State. Thank you very much. I appreciate you.
Thank you very much for having
us. And Mr. Ondubisi Kanu, Abia State Agency for Control of HIV and AIDS, ABSACA. Thank you as to do with us for Inside Studio this afternoon.
Thank you for having me here.
All right, Asidebi, thank you. Asidebi, put ear down on top of this particular matter. Continue to listen to Flow 94.9 FM Umar here, the flow of Godson State. Not forget that this evening we'll summer you Betalicious Disco. So that is a mommy's poo body because I will go shake body. And maybe that's not we can go Vinchilala. Continue to listen to Flow 94.9 FM Umar here, the flow of Godson State.